Healthcare workers. Those who work in a healthcare center to protect and improve the health of the individuals in their communities based on formal training and experience. In 1760, New York City passed the first law mandating the license of prospective physicians and penalizing those who remained unlicensed. As of 2018, the amount of healthcare workers in the US alone has increased to nearly 17 million. During the coronavirus outbreak, nearly all these healthcare workers have found themselves at the front lines, risking their health battling the effects of COVID-19 as first responders. In some states, medical staff account for as many as 20% of known coronavirus cases. My name's Anthony Padilla, and today I'm going to be remotely sitting down with healthcare workers to learn what it's like being on the front lines during this pandemic. Do healthcare workers on the front lines feel truly appreciated and compensated for their efforts at ensuring human safety? Or do they feel overworked and exhausted by the new demands of their job? Are frontline healthcare workers confident in their safety, able to instead focus their energy appreciating just how many lives they impact each day? Or are they terrified to step foot into work, tormented by the immense fear of being exposed to the deadly virus and potentially spreading it to their loved ones? Hello, Dr. Tansey.
Pleasure to be here, Anthony.
Dr. Shailey.
Hi, Anthony.
Katie. Thank you so much for coming on and teaching me about the wondrous world of frontline healthcare workers.
Thank you, Anthony. It's my pleasure.
What do you consider yourself? A healthcare worker, a first responder?
I would say a frontline healthcare worker.
I am a frontline worker, but I'm also a director for a Center for Global Health and Social Responsibility.
I'm more on the research side, trying to determine what makes certain people more susceptible. How can we find treatments ranging from regular medicines to natural products to even lifestyle? Mostly what I do in my day job is I try to cure Alzheimer's disease, and I discovered most of the known Alzheimer's genes, including the first ones.
What does being a frontline healthcare worker entail?
Being a frontline worker is anybody who is directly working with a COVID patient. But most people think about doctors and nurses, but it's also physical therapy, occupational therapy, it's social work, it's people in administration, it's people in logistics and running supplies.
What type of healthcare worker are you specifically?
I'm a researcher, so I'm a scientist.
I'm a family nurse practitioner and a nurse midwife. So most of my experience has been in primary care and urgent care.
I spend time in the hospital. I work with a bunch of residents who are in training to take care of these patients. Now, keep in mind, these might be patients with so many other medical problems too.
Right.
And we have to balance all of those things in the context of COVID.
What was going through your mind when you first heard about this coronavirus outbreak that was starting to make its way over to the US?
Is this it?
Is this it? The big one.
You know, a lot of people in the field, epidemiology field, talk about it's been about 100 years since the big one from 1918. And so a lot of people were concerned that it's about to happen again and almost like we were overdue. So people in the know had this sense of, this could be it.
Did you feel prepared to take on this pandemic?
My first impression was, yes, we are ready. We have handled H1N1, we've handled seasonal flu. But the more information we got, particularly when we hear about the mortality, the people dying from this is much higher than the seasonal flu, then you sort of wonder, do we have the capacity to handle the load of a lot of people getting sick at the same time? And that, I think, was when I started second guessing.
How has your average workday changed since the COVID-19 outbreak? It's always a good sign when I get just silence and then a laugh.
Yeah, it has changed so much. And my average workday used to be I would go into a busy low-income Medicaid clinic and I would hit the ground running and see anywhere from 20 to 25 patients in 15 to 20-minute intervals for 8 hours. Now I go into work and I have anywhere from 30 to 50 patients on the ward and everyone is extremely sick. They've got a lot more serious chronic conditions.
Have your hours changed, anything like that?
I'm working 12-hour shifts every single day.
And how long have you been working 12-hour days?
I've only been working 2 weeks, so not so bad yet.
But you've worked 14 days straight, 12 hours each day?
Yes, I have.
You act like that's so casual. That is a lot.
I know, when you put it like that, I realize it's a lot, but the patients are so wonderful. And it's been at times it's been incredibly frustrating and I do cry every day, but it's also an incredibly joyous experience.
Do you have easy access to COVID-19 testing because you're exposed to it so frequently?
I've had symptoms for a while, and I only got tested yesterday.
So you could be positive with COVID-19 right now.
I had the respiratory symptoms and the abdominal symptoms.
And are these symptoms that you may have picked up from working in the field?
Who knows? I mean, no one, I just don't know. I just know that they're consistent. It's funny because I don't know if I want it to be negative or positive.
Yeah, you're like, am I crazy if I think I have it, but I don't have it?
And if I do have it, like, okay, at least I know I have it and I can hope for immunity. But then I have to go to bed saying, man, this virus is inside of me. That sucks.
Some people claim healthcare facilities are functioning as usual. Nothing's different.
That is not true.
While others and the media and the news is showing just how overrun many facilities are and how understaffed they are and how they don't have the resources they need to withstand a pandemic like this. Have you been able to witness firsthand what it's really like?
So some hospitals are pretty empty because they're not the COVID hospital. We're in a pandemic and people are self-isolating. So sure, that can be true for those hospitals, but the rest of the hospitals are a total show. Some of the ERs around here have started to get better, but now the ICUs are overstaffed and overrun. I mean, some nurses are on a 6-to-1 ratio. Normally it should be a 1-to-1.
Before we learn more about the wondrous world of frontline healthcare workers, I just want to take a quick moment to say that 100% of profits from this video will be donated to First Responders First, a fund dedicated to the frontline healthcare workers serving the nation during the coronavirus pandemic. Donations made to First Responders First will provide essential supplies, equipment, and resources like online workshops and virtual training to protect these heroic healthcare workers. For more information, I'll include a link to Thrive Global's First Responders First website down in the description below. And to everyone staying home, practicing social distancing, and taking this quarantine seriously, thank you for doing your part in ensuring we make it through this as painlessly as possible for your health and for everyone around you. It's tough now, I know, but if we all take this as seriously as possible, I truly believe we'll make it to the other side of this and be stronger as a society than ever before. That's all I wanted to say. Now back to learning about the wondrous world of frontline healthcare workers. What's something everyone at home should know about this pandemic that they might not have heard through news outlets, for example?
The biggest thing we're finding now is that none of the medications are working that great. What's working the best is flipping people over onto their belly. It's a positional change is giving us the best result for the respiratory distress.
What's that help? That's helping them breathe better?
One is it's taking a little bit of pressure, like the heart takes pressure off the lungs so they can actually get more lung volume and elasticity and lung capacity. But the other thing is the little blood vessels that are going by something called the alveoli, which is like it looks like a little grape bunch at the bottom of your lungs where gas exchange happens. When you press on it, you're physically pressing the vessels closer to those alveoli so the gas exchange between the lungs and the blood can happen when you go on your belly. Yeah, it's really fascinating.
One of the things we're taking very seriously is keeping track of those who were infected who didn't have symptoms. Well, if you look at the surveys, just random surveys of people who are infected but were asymptomatic, that real number of confirmed cases, it's probably at least 10 times higher.
Really?
Well, this thing can get into your brain through your nose. And, loss of taste and smell, which you've probably heard about in patients.
Yep.
That's because it's inducing inflammation in the brain. There's a cytokine storm in the brain. In Alzheimer's, it's the same thing. You get a cytokine storm that leads to most of the cell death. We're just setting up a whole protocol. So if you know when we have the antibody tests fully available, everybody knows if they were infected or not, we're going to have ways to keep track of your brain health.
Are you able to compartmentalize the stress you face in your work life away from your home life?
I'm not sure if my man will agree with that, but I like to think so.
Yeah, when he sees you sweating and like freaking out in the corner because you don't know what to do or not being able to fall asleep.
Yeah, or just being snappy for no reason, because I had a tough day.
You have been working 84-hour work weeks for 2 weeks straight. I can't imagine being able to completely shut that off and remain normal at home.
And I'm working, I'm eating, and I'm sleeping, and then repeat.
And then you're doing an interview while you're eating off camera.
Or just drinking the wine.
Have you noticed a change in the way you and others working on the front line have been treated during all this?
Yes. So I was walking to work. I was in my scrubs on the way to work, so I was not contaminated. And this guy looks up and he looks at me and he goes, "Oh my God." And then he crosses the street and gets as far away from me as possible.
Wait, so you are putting your health at risk, helping people for 12 hours every single day, not being able to eat and barely sleep, and you have people judging you and trying to get away from you because, what, they think you're contaminated?
It's actually a really big problem. A lot of us are being told not to wear our scrubs to or from work and to change into our scrubs when we get to work because there have been some assaults on healthcare workers in scrubs because people are afraid of us.
What has been the most difficult part about working on the front lines during this pandemic?
Politics and finances are the biggest barriers to care. And because of those things, people are dying. We had 3 people in New York City die in hotels over the weekend. And yet here we are with all of the resources in the world to help them. We have empty beds, we have extra staff, and we're having problem getting patients to us because of politics and finances, because they don't have the right insurance, because the hospitals want to keep as many patients as they can because they're billing for those patients, or because the credentialing and the HR at the hospital hasn't gotten it together yet to onboard the staff. I mean, the bullshit administrators and financial people and politicians are huge barriers to care.
Ash Bennett wants to know what you'd say to people claiming that COVID-19 is fake and they might even be out there protesting against it during this lockdown.
Look, if you open up too soon, we will not handle the influx. We will have people dying in football fields on blankets with no ventilators, suffocating. Lots of them. You have to think, when you go out there and you're complaining, I can't go to the restaurant and get my hamburger. Oh, I want to open it up. This is all fake. No, it's not fake. This is a nasty, nasty virus.
The number of people who are dying from this is scary high. It's not a joke. It's not something that's made up from one political party to get the other political party down. Nothing like that. It's quite a serious thing.
Right. It would have taken such a massive group effort to make the entire world believe that this virus exists if it didn't really exist. I just don't think that we would ever have that kind of power to work together like that.
Absolutely true.
Valeria Rodriguez wants to know what you learned from this situation that you may not have already known or learned from medical school.
We're working on how to get an antibody test sent to homes. But 2 people in my lab are leading that effort, how to do that the correct way with the right privacy and safety and everything, reliability.
Well, you and the people working in your lab are potentially doing what could save many of us, maybe save our economies, save people who need to do essential work.
And you have to try everything. I met a guy at a meeting who's like the mushroom king of the medicine world, Paul Stamets, who has like the biggest collection of mushroom extracts in the world. He said, I'm going to send you some extracts, you test them. And we tested to see if they would stop inflammation, because what kills a patient is the cytokine storm. You have the infection and your immune system's trying to fight it. And your immune system makes these chemicals called cytokines, which keeps the immune system ramped up. But if you have too many, you get massive inflammation in the lungs and you can't breathe. Well, we're trying to find, on one hand, drugs that stop the virus. On the other hand, we're trying to find drugs that tamp down the immune response and the inflammation. Yeah. You don't want to tamp it down too much too early because you need it in the beginning to fight the virus. Yeah. But if it's too much, then it kills you. So we found that these certain mushrooms extracts actually really tamp down the cytokine storm.
So these tests on mushrooms could eventually turn into something where you get tested early, you find out you have coronavirus, you let it run its course for maybe a couple days, and then you take something with this mushroom in it, and then it prevents your body from overreacting and harming or killing you.
Yeah, exactly. That's a pretty cool scenario.
What do you think about the current American healthcare system?
I think the stress test on the healthcare system is asking us that question. What would we like universal healthcare to be? Why aren't we emphasizing public health that much more? And why aren't we building up a primary care base that much more so that everybody is covered?
So we should be doing everything in our power to ensure that all citizens are covered. Their healthcare is maybe part of a government system to ensure the safety of an entire nation. And beyond that, we should even be ensuring that everyone in the entire world has access to healthcare.
It makes perfect moral sense. It actually makes really good economic sense.
It does, because as we see firsthand, if you're not prepared, your economy will fail, along with the health of its people.
Absolutely.
It's broken. It's awful.
And you're seeing that firsthand.
Yeah, I was sheltered to it because as I mentioned, I've worked in Medicaid for 15 years, and Medicaid is actually quite a good insurance if you live in an area where there are Medicaid providers and you can get specialty care and you have a good provider.
What would you say to any healthcare workers working on the front line who are watching this and are maybe feeling an immense amount of fear surrounding their conditions going into work each day and putting their lives at risk?
3 things. Thank you, be careful, and thank you.
Absolutely. Well said. What kind of long-term effects do you feel this pandemic will have on society as a whole?
A more selfless society. I mean, I'm seeing just in my little world of researchers, sharing of ideas and no one trying to protect their intellectual property. Just all hands on deck. I don't matter, we matter attitude. I hope that lasts, because that's probably the only silver lining I'm seeing out of this.
I think it's going to take a long time for us to feel comfortable with human touch again.
I mean, it's only been what, like 6 weeks or 7 weeks, and already I feel so inclined, like by my nature now, to avoid people.
I think that a lot of us are craving that warmth and that connection, and it'll take a while to get there. I think that, mental health is a big issue and will continue to be a big issue with feelings with isolation.
What's the first thing that you're going to do the moment that this quarantine is lifted and this is no longer considered a pandemic and you feel 100% safe and confident to go outside into the world to do whatever you want?
Probably go to my favorite Mexican restaurant, have a good enchilada.
Yeah, it's funny how many people I've asked to say they're going to go to their favorite restaurant again.
I got a few people listed and I need to go and give them a big hug.
You're just going to go give these people hugs?
Yes, yeah.
Ooh, I'm going to get on a plane. I'm going to visit all my best friends. I am going to go to a tropical beach and I'm going to tip the out of everybody I see.
Hell yeah.
I'm going to eat in all the restaurants. I'm going to travel. I'm going to travel and spend that money.
Yes, spend that money. We've been holding on this money because we're scared, but once we're out of this, we're just going to, the economy's going to boom. What do you think the biggest misconception is about frontline healthcare workers?
It's chaos. It's a changing situation every minute. They're going through hell. These frontline care workers are going through hell, honestly. The patients are going through hell for a different reason, but they're going through hell too.
I think that a lot of us, we're just doing our job.
You're not thinking that you're a hero this whole time?
No, this is what we do, and COVID is certainly a very scary thing for a lot of us because of the death rate, but it's weird for some of us having everyone, like in New York, everyone's clapping and it's like such a good motivator. Like,
I'm going to clap for you for doing your job. Let's all clap for her doing her job. I mean, you're not just doing your job though. You're putting your health at risk in this time when people are scared to leave their homes, and you're ensuring that people can return back home after getting into the hospital or coming into, getting your help.
I really feel like almost every healthcare worker out there that could be here doing this would be here doing this, because this is our job and this is what you do when you show up for your job. I
actually have a parting gift for you, a Best Interviewer shirt, much like the one you see with inverted colors to your left. And you could get this at padillashop.com, but for you, I will ship this to you for free, assuming that you take necessary precautions and not touching it until you're confident it is safe to touch.
Thank you.
All right, you got 5 seconds to shout out or promote anything you want directly into camera. Go.
Once we get through COVID, please support Alzheimer's research. It's the #1 enemy. Cure Alzheimer's Fund.
Physical distance, but social solidarity, and believe in science.
Support your local food bank, support your local restaurants, support your local housing programs. Please, we need you.
Anthony Padilla is an amazing interviewer. as I've learned, not just by watching YouTube, but by this interview right now, support him, subscribe to him. He's the best.
Oh, thank you.
I mean that. That was great. This was great.
Thank you so much, Dr. Shailey. I feel like I now understand the wondrous world of working on the front line in the healthcare system just a little bit more.
Thank you, Anthony. It's been my pleasure.
After spending the day with these frontline healthcare workers, I've come to realize just how much they put on the line every single day, sometimes risking their own lives just to save others. Now, more than ever, we should take the time to appreciate those working and fighting to keep people healthy during these uncertain times. Please, for the safety of yourself and everyone around you, practice social distancing and stay home unless absolutely necessary. See you later, bye guys.
Press a like.
But you also didn't know when you signed up for this that you were going to be working during a pandemic.
No, I signed up to work pandemic.
But I mean, when you got into healthcare in the first place.
No. Like, no, that's exactly what I did.
Yeah. You're like, someday there's gonna be a pandemic, and I want to be there on the front lines.
No, you're right. We had no idea that this storm was going to happen in 2020.
And it happens so quickly.
It's crazy out there.
Crazy.